Oh, welcome back. We're excited to have you again to our weekly podcast, Beyond the Exam Room. And I'm very, very lucky to have Chris Sitton with us from Hope Hospice, which is an incredibly valuable nonprofit organization in New Braunfels. And Chris, thank you so much for being here.
Oh, honored.
I cannot even begin to tell you how much I appreciate Hope Hospice and what they've done for our patients and, of course, their family members. And so, I think there's a lot of misconceptions about hospice. And so I'm so glad you're here so that we can kind of talk about it and dive into it if you don't mind.
Absolutely.
Okay.
Absolutely.
So, why do you think there's such a big misconception in the market, even with physicians, about what hospice is?
It's a challenge that we're constantly battling.
Yeah.
In the community, hospice is just for those last few days of life, and unfortunately, that's because that's when many people use it for those last few days of life. But the benefit is actually a much more extensive benefit. It's a 6 months or less, depending on how things are going, and with recertifications, patients can be on for years, as you know, on hospice care, as long as their needs and everything are being addressed, and as long as they still qualify. But I think as far as the physicians go, I think sometimes that idea that I've got to give up to let my patient go on to hospice, because physicians don't want to give up. They've been with these patients all these years. They're part of the family almost. They've been through all the different cycles of life, and they just want to keep trying. They want to keep trying, and sometimes we go past the point of where that trying is beneficial to them physically, mentally, emotionally, or any other way. But it's still hard to let go. And I heard a study a long time ago that the more a physician may know you or be close to you, it messes up their prognosis by like a factor of 3. So if a physician said, I think you've got 9 months, then you really have probably more like 3 months, because they're connected with you, and they're hoping for the best for you, and they want the best for you. And so it's just a natural thing to put that into practice. And I think physicians are people too, and they love their patients, and they don't want to give up, and they want them to get better. And I'll be honest, we want them to get better as well. We're always hoping for that miracle, and occasionally that thing can happen. But in the meantime, we want to make sure that we're taking care of folks and addressing the symptoms and the psychosocial dynamics that the whole family is going through. It's not just for the patient. We are there for the family as well.
Yeah, I think that's one of the big misconceptions of that too, is that when you bring in hospice, they think it's just about, putting grandpa or grandma, and just giving them just something so they will die quicker. It's just opposite. I mean, from what I've seen, what the support that you give to the family members, the entire family, and especially the caregiver, it's irreplaceable from what I've seen. So, I want to again thank you guys for what you do in the community. But it's really important for us to understand that what you said is when you're looking at benefits, hospice comes from a different bucket. Can you kind of explain that?
Medicare, like a lot of things, does cover end of life care.
Right.
But there's a variety of things that help with that. Medicaid can help with that. Private insurance can help with that. And then, since we are a nonprofit, we have a community assistance program. And if somebody elects that, if they don't have any of those things, they don't have Medicare, or maybe someone's a younger person and they're not able to work anymore, they lose that insurance that they've had all those years. And unfortunately, we see more and more of that all the time. That community assistance program can help fill that gap. We don't turn anybody away because they can't pay. And I've worked for other hospices before, and they'll take 1 or 2% of their patients as unfunded patients, just kind of as their way of giving back. But we probably have 40 right now, unfunded patients, or we say underfunded or underinsured. Some people's benefit will cover a little bit, but that doesn't mean it covers everything that they need. And we want to make sure that we're treating our patients that don't have the funding exact same way that we would treat somebody that has the full Medicare benefit. We give everybody the same level of care.
I know, it's incredible what you guys do. So if you were to advise some of my patients about, because at the end of the day, we kind of try to not, avoid the inevitable, right? We all know that we're not going to be here forever. And so it's never a fun discussion to have. But if you were to have that discussion with like a lot of the patients, what would be the one fundamental thing that you would give advice to? What would they do? What would you,
As
what
far
kind
as
of advice?
getting them to,
Yeah.
to choose hospice
Yeah.
care, and it's kind of funny you said this. I had the same I don't want to say argument, but conversation with my mom, trying to get my mom to be in hospice care. And at the time, I'd been in hospice for like 26, 27 years, and she'd seen all the things I've done. But when it comes time to you, and it comes time to your mom, well, no, I'm not ready for that. I'm not ready for that. And I would just say, it's okay. You don't have to be ready. You don't have to be ready. But if a physician is recommending it, then take advantage of the opportunity because of the additional assistance that you get. You mentioned it earlier. People do well on hospice care. Most patients will live actually a little longer on hospice care because they're getting their medications managed better. They're getting the weekly nurse visits. They have things addressed in a timely manner, and so folks do better. One of the things that was important to my mom, and I feel like it's one of the best things about hospice care, is that if you need help 24/7, nights, holidays, weekends, it's available. There's an on-call number, and you know, home health also has an on-call number. But if you get into a bind, they're going to say, well, you need to go to the emergency room.
Right.
With us, everything that we do is we try to keep them from having to go
Right.
back into the emergency room, because at the end of the day, if they go to the emergency room, odds are they're going to sit there and wait for a while. They may get some fluids or something else, but they're going to be sent home with the exact same problems that they went there with. And so with that on-call support, we're able to come out there, we're able to address those things. And maybe it's just a level of anxiety, but letting somebody know, hey, we're here, and I know what's going on feels out of control, but we're going to take care of you, and we're going to make this okay, and we're going to make you feel better, we're going to make you comfortable. And if we can make you comfortable, I know your family's going to be comfortable, and then everybody feels better. But trying to help people understand that, to answer your question, is hard, because people are like, well, I don't want that, I don't want that. And we tell people, you don't have to take an oath that says I'm ready to die. You don't have to take an oath that says I'm ready for hospice. Just allow us to come in and make things easier for you and your family, because people don't realize the support that they get with the home health aides, the certified nursing assistants, the bathing assistants. We want that person to be able to save their energy for the fun things they want to do, whether it's harassing their grandchildren or giving their wife a hard time, or all the things that we normally like to do every day of our lives. But toward end of life, those things, the getting dressed, the doing the laundry, making the bed, those kind of things do get exhausting and hard, and you don't want to spend your credits on that. You want to spend it on the things that are fun and enjoyable and meaningful.
Yeah, you hit the nail on the head. When I have this discussion with our patients, it's about quality of time, right? And think about it. A lot of times patients, I mean, I'm sure you've seen this before too. I have patients literally in their calendar, and their caregiver will show me their calendar, and it's doctor's appointment, infusion, doctor's appointment, procedure, doctor's appointment, imaging. And so literally they're going from one doctor's appointment to another doctor's appointment, getting all these, procedures may or may not help,
Right.
but the reality is that they don't seem to understand that every single hour that you're spending at the doctor's office, that's 1 hour that you're not having quality time with your family. And that's exactly to your point.
Right.
Right.
And so many of those things have statistically, as you said, statistically poor outcomes.
Right.
I mean, at a certain point, those treatments aren't going to be helpful. They're not going to be beneficial. Some of those things not only don't extend your life, but they're compromising the time that you have. A lot of the therapies, chemotherapy, radiation, is very hard on your body.
Mm-hmm.
And when there's a chance of that fixing things, we don't want to take anybody's hope away. We want you to do everything that you can. But at a certain point, it's good for the doctor to be able to verbalize and the family to understand that we can stretch this into 6 months, but it's going to be a really rough, awful 6 months. Or maybe you can have 4 months of feeling good,
Right.
and being able to do some of the things you want to do. And generally, when people feel better and feel good, that 4 months turns into 5, and because they're not getting all those chemicals and things in their
Okay.
bodies, and they're getting some of that love and support and nurturing at home like we all need.
Yeah. I think what people don't understand, there's a fine line between prolonging life and prolonging suffering,
Mm-hmm.
right? And that's what I've a testament to Hope Hospice. I've never had a family member ever, in doing this for 25 years, come back to me and said, I wish you never, brought Hope Hospice in. I've not one time, not even once.
Yeah.
So that should tell you something right there of the benefit that hospice brings into the family members over there. So it's the opposite is true. They come like, thank God you did that. We can't, they've been wonderful, and just nothing but accolades. All, and I'm sure you get that feedback, right? That's what probably drives you too.
Absolutely,
Yeah.
absolutely. And the other part of that is we have a third party, all hospices have a third party survey system where people are sent a survey after the fact, the family sent a survey, what they thought of the care, the different parts of the care, and if they had any regrets. And the number one regret that people have voiced over and over again is, I wish that I had done hospice sooner.
Really?
You know, it's not that it. And back to the last thing we were talking about, I had a guy once tell me the doctor was saying to him, we can do this, we can do this, we can do this. And the guy said, is that going to keep me alive or is it going to keep me here? And there's a difference between just being here and living your life to the fullest, to the last possible moment that you can.
Yeah, I like that term. It's absolutely true. And that's so important. I guess, so what can we do as a community to get, spread the word to all the clinicians and all the patients and patients' families about getting more educated about hospice? What can we do?
I think part of it is just conversations like this, where we're kind of trying to get away from the stigma of the word hospice.
Right.
Everybody hears that, it's such a bad word, and really the word means comfort.
Right.
And so who wouldn't want more comfort at end of life? And letting people understand, just because a doctor recommends hospice doesn't mean you're going to pass away next week or even next month. As I said, we've had patients on for years before.
Right.
We've had patients on for hours before. People are generally somewhere in the middle. But hospice isn't going to do anything to speed that death up. We're not going to do anything to slow it down. We just want you to be comfortable through the process. And so it's just having these conversations, helping people understand. Hospice care is palliative care.
Mm-hmm.
That's kind of another big word that's out there right now. Palliative just means comfort. And so some folks aren't quite ready for hospice. We also have a palliative care program where we get people kind of registered. We check on them. We're kind of monitoring a few things. And then at a certain point, when the patient or family is ready for that transition over, we try to make that a little smoother. But at the end of the day, they're still not getting all the things and all the benefits that they would if they would go ahead and choose the hospice route. I think another thing that people don't realize is they think, well, if I go hospice, I could never change my mind, or I could never go back to the hospital, or I could never do all these other things. Hospice isn't a once and done kind of thing. If at some point you want to go back and seek more therapy, you can go do that. If you feel like, I don't know what's going on, but I feel like I need to go to the hospital, we want you to do that. We'll meet you. We'll up there. We'll get the revocation paperwork signed up. It's not a once and for all thing. It is there for you as a benefit. Medicare set it up as a benefit that you earned, that you work for. I think another misconception is that, well, hospice must be pretty expensive. They do all these things at end of life. There's all that equipment. There's all that staff. Medicare determines what all that stuff should cost, and so they pay a flat daily rate. Medicare covers that again, and so there's no out of pocket cost to the family, and people can't believe that because there's a catch everywhere.
Right.
There's a copay. There's something. There's this or that. There's not with hospice care, and so it's a benefit that you get to do, and to be able to say, we want to come in here and we want to provide all this care, this medication, equipment, supplies. And you're not going to have to pay anything. People don't believe it. They don't believe it. And so, but again, then they get that survey and they say, I wish we would have done this sooner because we finally got the help that we needed.
Yeah, if you look at, I agree. I mean, it's showing year after year that it's the same thing. The survey shows, I wish we would have started sooner. Mm-hmm. And then you go back to, why don't we? It's always the same kind of like conundrum, right? Why that happens. Yeah. So I really appreciate you coming out here because it's an extremely valuable resource for the community. And like I said, you guys, have been just wonderful. My patients and the caregivers that support all the community, they love you guys. And so please, Elle, you also have a program with the vets, right?
We do. The National Hospice and Palliative Care Organization, the VA, got together a few years ago and recognizing that veterans sometimes have different issues at end of life than other folks. Sometimes that's because of past trauma or conflict that they experienced. And so anytime any of us have to look at death or are facing death, we think about maybe other times when our life was in danger. And so it can bring back some of that stuff. And so we want to make sure sure that our vets have the best chance at a peaceful passing as is possible. And so we address some of those mental, emotional things. We address the soul injury that some of those veterans carry because of things they either did or things that they saw or things that were done to them. And then the practical aspects. A lot of veterans aren't enrolled in the VA, and somewhere between a third and a half. And so many veterans aren't even aware of benefits that they're eligible for through the VA, which can be a variety of things. And so we try to educate on that. And then we do some special recognition ceremonies for our veterans at end of life, because many of them, we see veterans out in the community all the time. We say thank you for your service, but many of our veterans, they served way back in the day, and they don't get that. If you're not wearing a cap that proudly says, hey, I'm a veteran, then people don't know. And for us to be able to come in and talk about the oath and talk about the flag and talk about that camaraderie among service members, it's a special thing. And so in addition to doing that for our veterans, we've got a wonderful group of veteran volunteers that help us out as well. We're always looking for more, and truly that's the most fun part of my job every day.
That's awesome. Veterans connecting with veterans. That's awesome. Well, I just can't thank you enough for your time today, and we'll make sure that everybody gets the information. All right. So thank you again.
Absolutely.
Thanks.
Thank
Appreciate
you.
it.